This segment of Delmarva Life is brought to you by Peninsula Home Care.
The power of a partnership when it comes to your health. Doesn't it just make sense to get as many teams as possible on board to ensure the greatest outcome?
That is the approach taken by the team at Peninsula Home Care, and we are learning more about that today with the help from PHC's Director of Operations, Beverly White, and the owner of physical therapist Shore Therapy Solutions, Lisa Clifford, joining us this afternoon. Ladies, thank you so much.
Yeah, thanks for being here.
Thank you for having us.
All right, Beverly, you're up first.
Okay.
Question is, talk to us about the partnerships. What's the goal with the partnerships?
Well, so I don't think people realize that Peninsula Home Care partnered with Tidal Health almost 20 years ago. Originally Peninsula Regional Medical Center.
Right.
And so it was a natural progression for us when the merger and the acquisition of Nanticoke Health Services became involved with the Tidal Health, what it is now. It's always been really important to our agency and the culture and the legacy that PRMC has always maintained in this community. So we embody that same commitment and that same legacy. It just seemed like the appropriate thing to being an active member of this community, being a good steward for our patients, that we find other agencies that will provide the same excellent care that we do to make sure that people stay better longer and are successful being at home.
Yeah, and these partnerships can last even after home care?
Oh, absolutely. And I'll let Lisa share a little bit about how we've been able to transition some of our patient services in that integration over to Shore Therapy Solutions.
So what we've had is a continuum of care. We have a lot of patients who have gone to Tidal Health, for example. They had an inpatient stay, they have Peninsula Home Care come out, they take care of them, get them to the point where they're doing better, but maybe they have a chronic condition, maybe they have something that is life-altering, and they're going to need continued care, and we're able to come out and see them in their home where they're comfortable and get them to their best potential.
So how did this idea for service come about?
Well, so I worked in home health when I moved down here to the area we've been here about 6 years or so. I started at Tidal Health, then PRMC, and I was there for a little over a year. Then I went back into home health because that's what I had always loved. I had my own practice when we lived in New York. And I came down here and I said, there's really a need in the community. There's a niche that's not being filled. We would get patients, and similar to how Peninsula Home Care has been, they'd get patients, they'd do their best, they'd get them so much better. Their whole team of great clinicians would rehab them. We'd say, okay, it's time to go to outpatient for continued therapy. They would set them up with transportation. I would do the same as their provider and make sure we had great people in the community to help them. They wouldn't go. They wouldn't go for a variety of reasons. Obviously, COVID is still, a thing that we're dealing with in healthcare in general. Patients just don't want to go out anymore, or maybe they're just comfortable being at home, or maybe it's something that by the time they get to an outpatient clinic, they're too tired to actually benefit from the full services that could be offered. So doing it in a place that's comfortable for them and we can bring everything to them, that's what was missing. So that's how Shore Therapy formed.
So how do these partnerships work?
So for us, it's human nature that after we are finished, because our services are acute, so we're in for maybe 2 or 3 months, and then it's our responsibility, or I believe it's our responsibility, that we transition you to the next level. Historically, that's always been outpatient, but in the last years, we have some patients that are just not able to still get out there. And then there's still some that are really reticent to go back out in whatever this post-COVID world seems to be. The services for Shore Therapy is a transition to be able to continue to provide them, because human nature is when I'm no longer there, they stop practicing their exercises.
Right.
And then we see this revolving door of patients that just keep going back to the hospital, coming back to home care, getting better, going to the hospital, etc. So for us, it was logical to partner with somebody like Lisa to say, when we're done, I want you to be able to continue to maintain what you've done, continue those exercise programs, because our goal as a home care agency is to keep you at home, is to help you age in place, to age at home, and to be there as long and safely, successfully living independently as long as possible. And she allows us to do that. Our patients, we had a shared mutual patient that we have been seeing her for quite some time. Lisa also has her certification and developed long-term for wound care. So we had a patient that had a continued need to maintain, still needed some eyes on the home and not able to go to outpatient services even just once a week. we were able to give that patient to her. As soon as we left, she came right back in. She continued everything. The patient had a decline at some point, ended up rehospitalized. She came back to us for a while after that, and we'll transition back to Lisa again. So the continuum has totally redefined itself in these last few years. Services like Lisa's were never considered part of that continuum. It was hospital to home, hospital to outpatient. It totally redefined what that looks like, and it's amazing. It's better patient-centered.
So then let me ask you this question. What would you say to the potential client who says, I can't afford all that?
So our services and traditional home health are typically always covered by insurance. We accept all major medical insurance. The one thing that patients do ask about a lot is, well, do I have a copay? I go to an outpatient clinic and sometimes I have a copay. And some insurances do, some commercial insurances do. Most people that have Medicare and a secondary payment luckily do not.
Right.
They don't have a copay. But how we deal with something like a high copay or a high deductible, we work with the patient. You know, we can't change the insurance piece of it. However, if it's something where they have an out-of-pocket expense that's very high, well, maybe the order was for 2 or 3 times a week to have therapy. Maybe that just doesn't work. So we come up with a really good home exercise program. We communicate with the doctor and the patient and the family and say, these are the expectations. If you can do these things when you're there, when we're not there, these are the things you can do on your own.
Right.
And we can still get you better and still achieve those goals.
Getting them better,
There you
keeping
go.
them at home.
Yes.
Beverly White and Lisa Clifford, thank you so much.
Thanks so much.
Thank you for having us.